So he has pain on the left side and he is leaning towards the right side. Okay? That means lateral compression or medial compression? Lateral compression. So now if I have to position him, he has to lie down on right side or he has to lie down on left side? Right side. Right side. So you have to lie down on right side line. Okay? So head here, legs here. Sit here, right side. Yeah, right side. Head that side. Yeah, right. Keep the hand. Okay? So, now what will happen to the compression? What will happen to the compression? Compression will decrease because the pain is here, compression is here. So when we put something down like a roll and when he is side lying, so the compression will become released. Okay? So this is a positional traction for lateral compression. Positional traction for lateral compression. In the exam, I'll just give a patient has lateral compression of nerve on right side. Do a positional lumbar traction for this patient. That's it. That will be the question in the practical. Okay, or a patient has medial nerve compression on right side. Do the position for this particular patient. So this is one position. The next position to increase the traction, what you have to do is this leg straight, down leg straight, up leg flexion, flexion, flexion. Yes. Okay. Keep it like this. Relax, relax, relax. The other hand on the head, and can you rotate more? Okay. This is the position where the traction increases further. Can you take from one side? They have to see. So this position, that is flexion of one hip, especially the upper hip, and rotation of the shoulder in opposite direction is going to increase the traction in the lumbar spine. So first is without anything. If patient is comfortable, good. If patient says relieved pain, good. Still there is no relief of pain, then flex the hip and see if there is relief of pain. No, then again rotate the shoulder and see if there is any relief of pain. Okay? This will be for the lateral compression on left side, lumbar spine. If it is medial compression, stand up here again. Turn that side. If it is medial compression, again left side, medial compression, then patient will lean to the same side. Okay? If it is medial compression, patient have pain on the left side, but patient is leaning to the left side. That means how he has to lie down. What will be the traction position? Traction position is side lying on the same side. Okay? Now, if it is left side, so he has to lie down on the same side. So now you have to lie down on the left side, head this side. Again, that has to come in the lumbar spine. Left side towards me. Yeah, very good. Okay, leg straight. Turn the body little. Yes. And here. Okay. So this will be for left side medial compression. Okay. The traction should be, the position should be like this. Again, if you want to increase the traction, bend the leg and rotate the spine. Okay. That is the positional traction. Here therapist, I am not doing anything. I am not touching him. It is just a position I am keeping. By the position itself, there is a traction. Okay. Now, the next one is level specific segmental traction. Level specific segmental traction. Level specific means L1, L2, how to give traction. L2, L3, how to give traction. So like that it is level specific. For that, what I have to do is I have to palpate the segments of vertebrae. For example, so this is T12, okay, L1, L2, okay, like that I can see the intervertebral spaces. Okay, I have to feel the intervertebral spaces. Now if I want to provide any traction between L2 and L3, then palpate L2, L3, bend the leg, okay. Now keep the hand on one side rotation, okay, and if I just put my chest at the ASIS and lean on to the patient, okay, that is going to provide a more amount of traction to the lumbar spine. Okay, if I want to move more of lower level, then what I will do is I will move this lower one little more down and I will move to the more lower level. So it depends upon which segment. For example, L2, L3, I will keep it as L2, L3. If I want L3, L4, then I will put little more down on the L3, L4, then I provide the force. So that is going to separate the level wise amount of traction. Okay, this is level specific traction for lumbar spine. I'll remove this. Now next one is bilateral compression. Bilateral compression means both sides. Both sides, positional traction, supine, knee to the chest. Hold knees to the chest. Yes. That's it. You can do more within the painful areas. Okay. So this kind of traction will produce a force on bilateral lumbar spines that is going to decrease the compression. So this is a bilateral positional traction. Release. Down. Next one is unilateral traction. For unilateral traction, I have to apply the thoracic belt, thoracic positional belt. Okay, so this belt will stabilize the thoracic spine. I'm going to make the bed low, it will go suddenly. Okay, so stabilize the bed, because if I move with the wheels, then bed also will move. Now hip and the lumbar spine, you will get the traction. The hip joint should be 30 degrees flexion, 30 degrees abduction, and completely external rotation. Completely external rotation. Then hold at the ankle. Use your body weight and provide the traction. Can you feel the traction? Okay. And you can release. Again traction. Release. So like that you can give intermittent traction and release. Now, if it is for sacroiliac joint, the sacroiliac joint means there should be a strap at the sacral level. Can you give me that strap down? Okay. One, there should be a belt at the groin level, okay, to hold the sacrum into a position. Chest belt. Hip should be 30 degrees flexion and 15 degrees of abduction. Now provide the force. It will come to the sacroiliac joint. Okay. So, but there should be a belt which comes at the groin region. So this is again unilateral traction for sacroiliac joint. Now, so we finished with lateral compression, okay, medial compression, then lateral or medial compression with manual assistance, level specific traction, then bilateral traction, then we finished unilateral pull for lumbar spine and hip joint, then unilateral pull for sacroiliac joint. Now the next one is mechanical traction by using the machine. We can give in neutral position. Neutral position means like this, okay, supine. There is no flexion or no extension. Bend your legs. Lift your legs. Okay, this has to come at the between pelvis and the rib cage. That is the position. But this has to come in the center so that the traction is there in the central position. So this is important. If it is one side, then traction will be more on that particular side. Okay. Lift.
كيف؟ ليش ما تشوف؟
Any problem, Ali Hamoud?
حتى اسم الوالد قد يعرف.
So this should be in the pelvic region, between the rib and pelvic region, and keep the leg straight. Take this.
ماشي.
I just separate the legs. Okay. Now keep the legs relaxed. Attach it to the pulling section. Then switch on the machine. So these are the two modalities. This will be decreasing in the load, regressive mode. This is progressive. Progressive means progressively increasing in the load. Press this. You can adjust the newtons. 1.5 newtons into 10. So it will be 15 newtons. 15 newtons is equal to 4 kgs approximately. Okay. So his body weight is around 54, 55.
40.
5.2, yeah, 52 approximately. So 1/4 is how much? Around 15 kg, okay, or less than 15 kg. So 10 into 10 newtons, 100 newtons, 25 kg, so that will be more. 5 into 10, 50 newtons, that will be approximately 12, okay. So this will be his ideal weight we can start with. And the time, initially 10 minutes, okay, starting time 10 minutes, 1/4 of body weight, 10 minutes the time, and this is a safety valve.
يعطيك
This safety valve you can give it to the patient.
إذا حسيت بالخطر
Okay? If it is more painful or something, then if patient presses that, the machine will stop automatically. Then start. Okay, can you see the pull? It will be slow amount of traction which will be coming to the patient.
هدد
Okay, again it will stop after some time, again it will come. So this is a intermittent mechanical traction. Okay, stop. Okay, that's it, and switch off. No, I'm just showing the procedure, total procedure. Okay, now this is in neutral position traction. Now next you can do the traction in flexion position. So when you want to do flexion position, you have to get this bend. So this is a flexion position where you apply the traction to the patient. Okay, so you have seen 3 positions. Yeah, I'll connect. You can once you apply the traction, you can leave the knob so that the bed will separate. Okay, this is flexion traction, neutral position traction, extension traction is in prone position. You know prone? I
Yes,
know
yes.
everybody knows.
Yes.
So that will be the extension traction. Okay. Release. You can get it. So mechanical lumbar traction, 3 varieties: neutral position, flexion position, and extension position.
extension
Flexion position is used if the disc prolapse is posterior. Okay. Extension position is used if the disc prolapse is anterior. Okay. The next one is cervical traction, for the traction for cervical spine. The position, everything will be same for the mechanical traction, same like this position, but head will be this side. Okay. Say it. Come.
ما تخاف بساعدك زي رقبة بس رقبة لا ما عليك بس أنا عشان الحجم عشان تبان
رقبتي تعبانه
ما تخافش يا ابني حظبطك
لا لا تقوم يشرب
خلك فيه
شيء هذا
لك علي اني بصورك الا
يا شرور الذي الله لا يبين
ما يصورك ما بصورك ويقلب
خلاص
دقيقة التصوير شوي بسمح
الله اعترف
No, I'm not going to. Not going to put one.
دكتور هذا مسك من اول.
So this is for cervical traction. One at the mandible, under the mandible. One at the occiput.
هذا الجام.
Okay. So can you lie down?
ايش ده؟
Lie down. The easy side.
نعرف فيها
A little more down, 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 more down. Okay. The cervical spine should be in little flexion. Okay. At least 20 to 30 degrees of flexion. So you can put a pillow or you can put something so that the cervical spine becomes flexed. Okay. Then, so this one should be attached to the segment here.
Yes.
Okay. Now, can you go a little more down? Is it possible? A little more? Okay. Actually, the position should be like this. Okay, it should be like this. Okay. If you put 20 degrees of flexion, so it should not be in extension. It should be in flexion. So in this position, the procedure is same again. But the newtons, the amount of force here is very less. It is 1/8 of body weight. You know 1/8 means? Okay. So 1/8 of the body weight, and it can go up to 1/4 of the body weight. So for lumbar, it is 1/4 of the body weight to half of the body weight. For cervical, it is 1/8 of the body weight to 1/4 of the body. So that will be the force. The time again 10 minutes to 20 minutes. That will be the time. Okay. So I'll relax. Remove this. Sorry. Yes, you can get up. Get up. Okay. So that is a mechanical cervical traction by using the machine. Now we will see manual cervical traction. Thank you. Now we use manual cervical traction. Can you get up from here? Okay. Model?
تعال قوم يا ظافر.
Head here, legs that side.
راسك هناك. لا كل هذا بدأ واحدة عشان تسلموا. هذا ايفون هذا شوف.
So when you give cervical, you should have some leg support. Okay, you have some leg support like this, and bed should be higher in position.
انت على العموم تمسك.
بسم الله عليك.
Okay, bed should be at higher position because if it is lower, then you will be like this. Okay, which is bad for you, for your back. So it has to be in good height so that the cervical spine exactly comes to your thigh. Yeah, come down now. Come down. Down. I'm there. Relax. Remove this. Okay. The cervical spine has to come out of the bed. So can you come up little more? Little more. I'm there. My leg is there. Come down.
جد
ارجع ورا.
لازم يسحب.
جوهرة بنفسه.
Yes.
أيوه.
Okay. So now see, my thigh is there, so don't worry, it don't go anywhere. So this kind of security you have to give to the patient. Otherwise, patient will feel like this. They keep the neck in very tight position. So you have to tell them, my thigh is there, your neck don't fall, relax your spine, relax your cervical muscles. One hand on the occiput, okay, another hand on the one hand on the mandible, another hand on the occiput, okay. Relax, 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 relax. Again, just a pull to the posterior.
في ألم.
Okay. Again, it is 3 to 7 seconds of traction, then relax. Traction, then relax, up to 10 minutes. Relax, relax, relax.
دكتور.
Yeah.
إن lung.
Hmm?
Tongue.
Tongue went back.
No.
Biting.
ابلع الكل أطلع.
Okay. Relax. Relax. Now, you can give the cervical traction in various positions. You can give it in flexion. You can give it in neutral. You can give it in extension. You can give it in flexion and rotation to right side. Flexion, rotation to left side. In any of the positions, you can give the traction. Depends upon what effect you want. Okay. For example, if patient has more pain on the right side. So, if you want to open the right space more, then what I'll do lateral flexion to the left. So that itself will open. Then flexion, that itself will open further and provide the traction. That will be more opening of right side. So if you want for left side again lateral flexion, flexion to the right side. When I give a traction, that will be more towards the left side. If I want both sides same, okay, then I give just in the neutral position in a flexion. If the disc prolapse is posterior, okay, then I keep the cervical spine in 20 degrees flexion and give the traction. If the disc prolapse is anterior, then I keep the cervical spine in extension, then I give the traction. So you can get up. So depends upon the patient problem, my position of the cervical spine has to change. Okay. So this is the manual cervical traction. Okay. Now go down. Now some of the other positional tractions, for example self, these are self traction. By I myself can give the traction. So for example some surface is like this. If I do this, any traction is happening?
Yes.
No? Where? Where is the traction? Lumbar. So by using my body weight itself, I am giving traction to myself. So just by pushing onto something and leaving the lower body, that gives a good amount of traction to the lumbar spine. Or if patient leans here and put the head down, like what you have seen a positional traction. So that also give a good amount of lumbar traction. Or something a bar and you are holding it to that bar. So that also will give a traction. Okay, a rod and you are hanging onto the rod. So these all are positional tractions. This is positional traction, okay, by myself, and going prone on the bed is another positional traction, or hanging onto a bar, that is also another positional traction. The one more is we have seen mechanical by machine. We can do mechanical by just by a pulley. Okay, if you come to that room, I will show that one. That will be the last one.